Today, I am Shalomito and I'm going to perform the EINC or the Essential Intrapartum Newborn Care. So, EINC is a protocol, it is a package of evidence-based practices recommended by the Department of Health as the standard of care in all births for health workers and medical practitioners. Under the EO 2009-0025, dated by December 1, 2009, and it aims to ensure that health workers have the skills and knowledge to provide appropriate care at the most vulnerable period in a baby's life. Through the EINC protocol, there is a potential to decrease newborn death by at least half. So the procedure is, first, greet the patient. So, hi ma'am, I am Shalomito, student midwife for today, and I'm here to help and guide you before the delivery of your baby. So how are you feeling right now, ma'am? Okay, so you are fine. You feel pain a bit in your your abdomen. So your cervix is not yet fully dilated. It is only 8 cm. So while waiting, just relax and calm. And please do not drink or eat any kind of food before delivery. Thank you. So take note that it is not advisable for pregnant mother to eat or drink any kind of food because she will just excrete it during her delivery. Preparation for delivery. So first, we're gonna check the temperature of the room. So by using a piece of paper, we're gonna check the temperature of the room. So if this paper falls directly on the ground, and it means that it is free from air drops. And if this paper goes in any direction, it means that we're gonna check the room and close the windows, the doors, to avoid air drops or to prevent. Okay, so it is free from air drops. Now I'm going to proceed the next step, which is to check the client's comfort. So, ma'am, are you comfortable with your position right now? Okay, so the patient is comfortable to her position right now. Okay, so next is remove all the jewelries and check the needed equipment. So my patient has no jewelry, so I'm going to proceed to check the materials needed. So here we have umbilical cord clamp, thermometer for checking the patient's temperature, and ointment, eye ointment or the erythromycin for the baby, syringe for injecting the oxytocin to the mother, and vaccines to the baby. So here we have Hep B vaccine used for the baby, and BCG vaccine, and oxytocin given to the mother after delivery of the baby to promote or help the placenta excretion or expulsion, and lastly the VitK for blood coagulation and to stop the bleeding. Okay, so we have here the bonnet for the baby. Two pieces of sterile gloves and a kidney basin. Okay, so before we start, let's do some hand washing, sterile technique. So after doing proper hand washing, so two glovings, sterile gloving, then encourage the mother to push. Mom, inhale, exhale, and a count of 3, push. 1, 2, 3, push. Okay, mom, again. 1, 2, 3, push. So, then apply perineal support and control. Then apply support and control to support the baby's head. 1, 2, 3, push. Again, mom, in a count of 3. 1, 2, 3, push. Okay, mom, last. 1, 2, 3, push. And then call out the time. 3:45 p.m. Baby boy out. Then place or grab a clean linen across the mother's abdomen and arms for thorough drying of the baby. Then apply thorough drying for 30 seconds. Dry first the eyes, or wipe the eyes first, the face, the head, the trunk, the arms, and lastly, the legs. So, thorough drying for 30 seconds. Then, place the baby into skin-to-skin contact. Remove the wet linens. Then, place the baby into the mother's abdomen for skin-to-skin contact. Then, cover the baby's body with a clean linen to help prevent hypothermia. Then, a bonnet. So make sure that you will not cover the eyes. So the purpose of skin-to-skin contact is to promote mother and child bond and breastfeeding success and protection for hypoglycemia, and especially for thermoregulation purposes. Okay, so exclude the baby for a while for palpating the mother's abdomen for the preparation of injecting the oxytocin to the mother. Okay, so the purpose of giving oxytocin to the mother is to help after delivery of the baby. We inject oxytocin to the mother to help the expulsion of the placenta. Now, I'm going to administer the oxytocin to the mother. So, get the syringe and the oxytocin. So, remove the cap. So this is a vial, so I'm going to aspirate air and release air to the vial. So face the label, check the integrity, the expiration date. Okay, so aspirate now. Discard the vial, then inject the oxytocin to the mother. Then remove, do not recap. So now we're going to the next step, which is the cord care. So remove the first set of gloves. Observe the doffing of the gloves, proper doffing. Then discard to the waste receptacle. So now we're going to palpate the umbilical cord. So after the pulsation has stopped, clamp the cord using sterile plastic cord clamp at 2 cm from the umbilical base. So check the package, the integrity. Then clamp from the base 2 cm. Okay, so I'm done clamping the cord. Then, so after clamping the umbilical cord, clamp again 5 cm from the base. Cut the cord just near the first cord clamp. So, cut. And after cutting, wrap the umbilical cord in the scissors and put them in the kidney basin. Put in the kidney basin. So next, perform the remaining step of the active management for the next stage of labor. So wait for strong uterine contraction, then apply control uterine contraction in the uterine, continuing until the delivery of the placenta. So massage the uterus until it is firm. Then inspect the lower vagina and perineum for any lacerations. Then examine the placenta for completeness and abnormalities. So check the vagina for any laceration. Then, so placenta out. So check the completeness of the placenta. Check for any abnormalities. And check if the placenta is shocked. So discard. Perineal flushing to the mother. Clean the mother properly, the perineum, and perineal, apply perineal pad or napkin. Check for excessive bleeding using sterile gauze to get any blood clot to the mother's perineum. Then discard. Then check for the mother's comfort. Mom, are you okay, ma'am? How do you feel? Okay, so you're fine. And now, so check the baby's condition, the color, the appearance, the breathing. And next, now I'm done doing the mother care and the newborn care. Now, discard the placenta. Dispose it properly in a leak-proof container or plastic bag. So, this is a waste receptacle. Then discard. Okay, so decontaminate and soak in 0.5 chlorine solution instruments before cleaning. So the instrument used, soak it. Then decontaminate the second pair of gloves before disposal. So alcohol. Decontaminate, then remove. Discard to the waste receptacle. Then the contamination should last at least 10 minutes. Okay, so advise the mother to maintain the skin-to-skin contact with her baby. Okay, ma'am. Skin-to-skin contact with the baby. Then make sure that you cover the baby to prevent hypothermia. Then next, so the baby should be prone on the mother's chest in between the breast with head turned into one side, and also advise the mother to observe breastfeeding cues. Mom, so make sure that you will breastfeed your child. So mom, please maintain skin-to-skin contact with your baby, okay? Then please be aware of the breastfeeding cues such as mouth opening, lip licking and sucking, bringing hands to mouth, moving hard as if looking for the mother's nipple, clenching of fist and fingers over the tummy, then bending of arms and legs, and fussiness. Then support the mother instead her positioning and attachment, then wait for the full breastfeed to be completed. So assist. Okay, ma'am. Make sure to observe the baby. Maintain skin-to-skin contact. Okay, so after breastfeeding, get the baby and apply erythromycin or eye ointment to the baby. Okay, so the purpose of erythromycin is to protect the baby from gonorrhea and any infection from the mother. Okay, so done. And now we're going to administer vitamin K to the baby. So the purpose of vitamin K is to help blood coagulation or blood deficiency, and to prevent low levels of vitamin K. So check the label, the integrity of the vial, then release air, then aspirate, discard, then inject it to the vastus lateralis left intramuscular, then discard. Okay. So the vitamin K is 0.5 ml and it is injected into vastus lateralis, right leg. So now let's proceed to hepatitis B, or the Hepa B. So Hepa B. And then administer it to the vastus lateralis, left leg. Then discard. Again, 0.5 ml. So the purpose of hepatitis B vaccine is to protect the baby as early as possible from any exposure to the hepatitis B virus. So hepatitis B vaccination, 0.5 ml, IM, vastus lateralis, or in the left leg. And lastly, the BCG vaccine. So this is the BCG vaccine. Then BCG vaccine is to protect the babies from serious form of tuberculosis or the TB, such as TB meningitis and miliary TB. So administer through intradermal in the arm of the baby. So intradermal. Then discard. Then advise optimal delayed bathing of the baby. Ma'am, I advise to bath your baby after 6 hours because delayed bathing provides more initial skin-to-skin contact between you and your baby. So, and early washing can hinders crushing reflex. It can also lead to hypothermia, which means that the baby temperature of your baby drops below the normal, but also lead to infection, defect acidosis on brain hemorrhage. And whereas your baby wants to breastfeed, just breastfeed him. Okay, ma'am. Then thank you, ma'am. In the first hour, check the baby's color, breathing, check the mother's vital signs such as temperature, BP or the blood pressure, respiration, and pulse rate, and oxygen saturation. And in the second hour, check the mother-baby diet every 30 minutes to 1 hour. Then lastly, complete all the records. Okay, so that's all. Thank you.